Hey, this is Henry Sands with another episode of Real Talk. We want to thank our sponsors, our Park Bank. Thank you for everything that you're doing. Thank you for supporting us at this time. We want everyone to go and subscribe to our YouTube page and make sure you keep supporting us and get more of our Real Talk content. We have someone today who is someone who does a lot of work. I want you guys, she has a wonderful video that's called Healing, a healer video. She's riding her bike, so she's clearly a healthy person. And she's also a physician on Ho Chunk Nation. She works there. She's a physician at one of the clinics there on tribal land. Amy DeLong, how are you? Dr. Amy DeLong, I should say. How are you?
I'm very good, thank you. Thanks for asking me to be here.
Of course. How is all this treating you personally? How are you doing?
Personally, I'm doing okay. Everything is upside down, just like with everybody else. Just the fact that I work from home some days. I do patient care by telephone. I'm at home constantly with my 16-year-old son. So it's very different.
Yes. And how much time are you spending in the clinic these days?
I spend 2 to 3 days per week in the clinic.
And are you finding, since COVID-19 hit, are you finding more of an uptick of people coming in, or how has COVID-19 really impacted the nation right now?
We've had some positive cases. We have 2 clinics, one here in Baraboo where I work, and the other is up in Black River Falls. At the clinic, we just had our first positive last week.
Oh.
So we've done a lot of testing. I shouldn't say a lot, but we've done anywhere from 10 to 12 tests since this started, and more positive cases up north, not necessarily diagnosed at our clinic, but at outside hospitals and other clinics.
The coronavirus has really impacted the Black community for health reasons on underlying issues that we've had. It's really impacted the Latino community for a lot of health and other reasons. Has it hit the Native American community? Have you seen that it's really hit you the same way that it's hitting other people of color communities?
I don't know the numbers. Some places aren't collecting ethnicity. A lot of times American Indians are counted as other instead of, actually counting them. And actually, I myself got tested just a couple of days ago through Sauk County, and they asked my ethnicity. So I was pretty happy about that, because there's just not a lot of data on American Indians. And even when the pandemic first hit, there was a lot of, I think, other Native communities, in particular the Navajo Nation, that just wasn't getting a lot of attention, a lot of focus on cities that are more populous, and the Native communities were basically left out. So doing better. I think the federal government has done better in the last month in terms of funding for Indian health services and IHS, tribal and urban Indian health settings.
Leads me to a good question. Do you have the equipment you need? Do you have the mask and the gloves, and do you have all those things?
Yes, they're not in an abundant supply, but we do have personal protective equipment on hand. We are rationing them. We wear the same mask, surgical mask, every week, or until it's dirty, soiled, just not usable anymore. We have the N95s for those patients that have respiratory symptoms, and face shields for those who are screening all people who come into the clinic. So for the time being, we do have PPE.
Are you personally worried? What are you doing to protect yourself? You come home, you have a 16-year-old that you could come home and bring it home. So are you nervous about that, and how are you protecting yourself when you come home?
Good question. So if we were doing this interview at the clinic, I would be wearing scrubs and I would have to be wearing a mask, which is why I chose to come home, or why I'm home for this. So when I go to work, I change into a pair of scrubs, I put on a surgical mask, and I wear that all day, except when I'm eating. And when I leave, same thing. I change out of those scrubs. I put on, uncontaminated clothes and come home. So that's
Okay.
what we're doing to protect ourselves.
Yeah. Well, that's awesome. Is
Mhm.
your 16-year-old, is it a son, or is it, what you said, a son?
My son,
Is it,
just my son.
how is he? I'm just curious. How is a 16-year-old young man taking
Hmm.
this as a mom who's a physician? Is he
Hmm.
worried? How does he think about all this?
He's bored. He's he's playing a lot of video games. Although it's interesting, it's his social connections. When you play certain games, you can play with other friends. So he's maintained a lot of his social connections through video games. Um, but for the most part, he's online school is a challenge. I've gotten emails from his teacher saying he's falling behind. So we came up with a schedule just yesterday or the day before, so he's got some shape to his days.
Yeah.
So, yeah.
Are you are you are you finding that people are? I know there's the health issues, but have you heard any mental health issues? Or do you hear people who are talking to you and saying, "Doctor, help me, because I just can't deal with being inside so much"? Or
Mhm.
are you getting any of that?
Absolutely. In the beginning, there was a lot of anxiety about the pandemic. And now we're seeing a lot of more pronounced depression, anxiety. It's interesting. Some patients do well being at home, and others do not. Miss being at work, that was their social connection, was work. So they're laid off, not working, more depressed, socially isolated. So I've seen various responses. Our behavioral health department, who does, all the counselors, I know is very busy handling. I think even their counselors have had to take some time off, mental health days, because of the overabundance of people coming in, because they're not used to having nothing to do except be at home.
What advice would you give people who are like that, don't do well? Because I think, like me and my wife, this doesn't bother me at all. I mean,
So you're one of those.
doesn't bother me. I mean, this is great. We could do this for 6 more months, and it wouldn't bother me
Mhm.
at all. My wife, on the other hand, this is. I think work was her social. That was
Mhm.
her social life. Like, that was her way of communicating with people. Uh, what would you give advice to people like my wife who are like just stir crazy staying at home? Like, what would you say to them?
Um, and I'm guessing that you live in Madison,
I do.
right?
Yeah, I
Okay.
do. Yeah.
So here in Baraboo, it's just not as densely populated, so it's real safe and easy for us to get outdoors and um, not run into people. So I encourage people to get outdoors and walk. In fact, today they opened up the state parks, limited hours. I think the restrooms are still closed, campgrounds closed, but definitely to get outdoors and walk or do something, and do it routinely, like have some sort of schedule. It's kind of like what I did with my son, in terms of, let's get a schedule together.
Yeah, that makes
And
a lot of sense.
yeah, and I think, doing things that you've always wanted to do but never had the time to do, now that we're quarantined at home, but whether it's home projects or a new recipe.
Yeah, I get it. I'll pass that on because
Yeah. Right.
she's like, I can tell she's doing the best she can, but
Yeah.
me, I'm like, whatever. It's a party. Everyone, we get to see each other all day, every day. Yay, yay. So
And doing okay.
I'm doing. Yeah, I'm great. I
Okay.
mean, I'm awesome. Okay, so tell me, for COVID-19, what are your biggest concerns for your constituency, or what are your concerns for the people that you really serve the most right now?
Hmm. Um, I would say my biggest concern is the antsiness that people are feeling right now, because it's been, at least a month that we've been quarantined, laid off, that sort of thing. And it's really, and spring has sprung. So people are chomping at the bit to get out the door and do things. And just be more social. And my advice, or my concern, is that people now are going to not abide by the shelter at home order that the governor put in place. And I would really, like, one of the best ways to prevent this coronavirus from spreading is social distancing. So we stick amongst our people, our family at home, and limit our contacts to that. We've got another month of this, May 26th is the end date. So that's my concern. The other concern I have is I work with a lot of patients who have type 2 diabetes, hypertension, and even heart disease. And those patients are more susceptible, more vulnerable to type 2 the coronavirus. So as we go through another phase of patient care and who we are going to see in person, I think starting next week, we're going to start actually doing more lab work on patients with diabetes, just so we can better assess how they're doing with their blood sugar control, that sort of thing, and check in with them. So just trying to really help people with chronic disease take good care of themselves during this time.
Is there anything that people with type 2 diabetes or hyperextension or things like that they have right now that they can do to prepare themselves, protect themselves more? Like, what can they do? What advice would you give them to, not to get them really scared and nervous, but like to say, here are the things you can do to be proactive?
Right. Well, one, social distancing, and two is to take really good care of their chronic disease, whether that's type 2 diabetes or high blood pressure. So again, that's taking your medications, adhering to your diet, if it's low carbs or moderate carbs or low sodium, getting out and walking now that the weather is more accommodating, and just, good rest, taking good care of yourself, and social connections. We're not able to interact personally with people right now, but it is possible to Skype or Zoom or FaceTime. So I encourage people to stay in touch with family members as however they can and on a regular basis.
This is an ignorant question from a guy who's not, Native American at all, but it's an ignorant question. I'm saying that. I understand it's ignorant.
Okay.
But what are the cultural differences from being in a typical clinic like in a Madison versus being in a tribal clinic? What are the differences from other cultural differences that you deal with that a average physician wouldn't deal with, say, here in Madison, you think?
I think, what sets us apart from any other clinic is our population, right? So approximately 80% of the patients we see are Native American and mostly Ho-Chunk. So that's number one. And so as a result, there's a trust issue. I find that when we bring on a new physician or a new nurse practitioner or a physician assistant, it takes some time for them to build up their patient panel. There's got to be, trust, where a word gets out like, I like this person, they're good. And probably over the course of about a year, it takes about a year, you find that more community members, there's less no-shows, more people show up for their appointments because they know you, they trust you. So I find that trust is a big thing, that, maybe other HMO clinics maybe they have, maybe they don't have. I don't know.
Yeah, that makes sense to me because trust is a big thing for anyone. Yeah, I totally get that. Yeah. Are you hoping that, when do you think that it'll be, what signs are you looking for to say it's okay for people to start being more active and going back to like the casinos or going back to, like, when do you think, what signs are you looking for Marlon calling you and saying, hey, look, I really think the casino should be back open. What do you think? I'm hoping he would call someone like you, like a physician or someone, right? Like, what are you looking for? What signs would you be looking for to be able to say, yeah, we can move in that direction?
Our incident command team has been discussing that very topic on when do we open our doors just a little bit more, to see more patients in person versus telehealth. And one of the, objective measures is just the data, like how many, they talk about the curve flattening. So how many new cases, new positive cases are we seeing? Because it's continuing to go up. So I think when we see it coming down steadily, we haven't quite determined over 1 week, over 2 weeks, when we could start to, go to the next phase and open our doors and see more patients in person. So we need the data. So we're kind of and Wisconsin state is tracking it. So yeah, we have, that's exactly the conversation our ICS team is having currently.
Yeah, everyone wants to get back, but you want to do it smartly and the right way. Correct. And I'm guessing that you'll be part of those conversations with your background, right? So,
yeah.
Well, is there anything else you want to leave our viewers before we sign off here about COVID-19, about staying healthy, about safer at home? Like, give us your words of wisdom from all your wonderful experience.
It seems generic, the whole, take good care of yourself. But as a physician who is a caregiver, both at work and at home, so important to take good care of yourself. And that means good rest, good nutrition, staying hydrated, and even getting outdoors. I'm an outdoorsy person. And so getting outside and whether it's walking or hiking, biking, keep your distance, but stay well.
Yeah. Well, thank you for your time.
Yes.
And thank you tell your 16-year-old son, thank you for letting us borrow you for these 20 minutes. And we want you to stay healthy. And please, if there's anything we can do to get the word out, we're here for you. And thank you, sincerely. You're on the front line right now. So thank you for taking your life at risk. Literally, you are for serving people. So thank you so much. We thank you for everything that you're doing.
Thank you for interviewing me, Henry. It was a pleasure.
Yes. Thank you. And we'll see you next time for another episode of Real Talk. Take care.